You want to lose weight? Diet and exercise are not first-line recommendations anymore. That's right. The American College of Cardiology just released a brand new statement, and they said that diet and exercise are no longer the first-line treatment for weight loss. It's actually GLP-1 injections like Ozempic, Mounjaro, Wegovy, and others. But wait, what if you have a chronic condition like rheumatoid arthritis? Because for you, the rules are different. RA changes everything: your metabolism, your muscle mass, and inflammation levels. Now, if you have rheumatoid arthritis and you want to lose weight safely, there are 3 things you absolutely need to know. They're simple, but they make all the difference. I'll get to them soon, but trust me, if you skip them, this whole weight loss journey could end up doing more harm than good. I'm Dr. Badasali with Plant Forward MD. Let's dive in. Now, I am a big fan of these medications, and we're going to talk about that. We just need to figure out how to use it when you have rheumatoid arthritis. But first of all, even before you start one of these injections, you need to look at your medication list because they may also be affecting your weight. For example, if you've heard of a medication called leflunomide or Arava, we think of it as more of a sister drug of methotrexate. So methotrexate is commonly used, but not everybody can tolerate it. And so oftentimes we switch to something called Arava. And it has a similar profile in terms of side effects, except it can cause weight loss. Some of my patients have called it the Ozempic of weight loss. It doesn't cause weight loss in everybody, but for some people it's pretty dramatic, like 20 pounds right away. And then when I've stopped it, the weight starts stabilizing and coming back. So some of my patients have loved that and some have not liked losing that much weight. So it kind of depends. Ultimately, you have to see how you feel on the medication because you want it to help your joints and your pain, your fatigue, and all of that as well. Another medication, gabapentin or even pregabalin. So pregabalin, Lyrica, we usually tell people that it can cause weight gain. However, with gabapentin, which is incredibly common and not just used for people with rheumatoid arthritis, a lot of people with chronic pain take it. We don't often talk about the weight gain potential on that one. So take a look to see if you're taking that, because people can take anywhere from 100 milligrams to 1800 milligrams to 2500 milligrams. So it can be a lot of variability in that one. And of course, steroids, whether it's prednisone, methylprednisolone, Medrol, any combination of that or others can cause weight gain, because it increases appetite, and not only does it promote fat to increase, it kind of centralizes it. And so it kind of comes in the truncal area, which most people don't want, but unfortunately that's where it distributes to. And at the same time, when you're taking steroids, it can be breaking down muscle. So if you're wondering why your weight is changing and you have a new medication in your list, take a look at that first and see if that could be influencing it. Okay, here are the 3 things that I mentioned earlier. The ones I want everyone with rheumatoid arthritis to focus on before trying weight loss medications or any quick fixes. What actually works for weight loss in rheumatoid arthritis? Let's keep it simple, because losing weight can help your joints, it can help your heart, and we know that with rheumatoid arthritis, you have an increased rate of getting cardiovascular disease or heart disease. So we absolutely want all the little parameters, whether it's weight, blood pressure, cholesterol, we want everything kind of stabilized and improved and optimized, right? Because we want you to have a long health span and a healthy one. You don't want to live to 100 but not be able to do anything. So we want you to be healthy. So this is what I suggest. Number 1, choose anti-inflammatory, nutrient-rich foods, right? Because these injections, they do cause a decrease in appetite. So you may not feel like eating. And it may be that you're working late, you don't have time, and you stop by for fast food and you're like, I haven't really eaten much today. Let me just stop by, grab this, and go home. I understand that time is short. It is for most people out there. There's just so many things to get to. But if that's the only bit of food you're going to eat in the day, that's the big meal of the day, you want to make sure it's packed with as much powerhouse foods as you can put in it. Because when you're eating less, it's more important to eat well, whatever you're eating. So think plants, healthy fats, fiber, plant-based proteins. Still recommending the 30 different types of colors and plant foods in your diet during the week. Choose your protein. Whatever you choose, make sure that it's a healthy protein. These aren't just supporting your weight, they're also supporting your immune system, your joints, and your overall health. Number 2, move to protect your muscles. Most people lose muscle when they're losing weight, with these injections especially. And with rheumatoid arthritis, you're already at a risk for that. So even short, gentle, strength-based movement can really help. You can use resistance bands. You can order them tonight from Amazon. You can use them on your arms, your legs, so many different areas. You can also do water therapy or water aerobics. I've had patients of mine meet in water aerobics class and discover that they see me. And almost everybody has told me that they enjoy water aerobics. It's just hard to kind of find a facility sometimes. You could even do chair exercises, chair yoga. There are so many different kinds out there. It's just literally a YouTube video away if you want to get started on something. These exercises can make a huge difference while you're taking these injections or otherwise in weight loss. Because number 3 is don't just track the scale. What matters more is, are your joints less stiff? Are you less tired? Are you able to do more than you could do last month? That's what progress looks like in rheumatoid arthritis. When this statement first came out from the ACC, a few of my patients said, wait, do doctors just not trust patients anymore to lose weight with diet and exercise? Now we need injections? And I get it. That reaction is completely valid. I kind of thought of it myself first too. Why aren't we telling people that they should eat properly and move more? Because we know that also helps. So here's the issue. It's not that doctors don't believe in patients, but it's recognizing how many barriers exist nowadays with working families, all this ultra-processed food everywhere around you. Sometimes that's all you can get. My office doesn't even have a cafeteria or any place you can actually get food. Yes, there's plenty of donuts and cakes around because sometimes you're hungry and there's nothing else you can get. That's the easiest portable food. Some environments are just not conducive to healthy eating or moving because you have to sit in a desk job and you can't get up because your boss will get mad at you. Having metabolic conditions or even chronic illnesses like rheumatoid arthritis. And it's been challenging getting these medications from insurance companies. As I'm sure some people have tried, if you don't meet the criteria, you cannot get the medications. So by the ACC coming out with this statement, this hopefully will make it easier for people to get it, who need it, who may not hit that exact check mark. So what I want you to know from this is that you're not being written off. You're just being offered another tool, but this tool only works right when you're using it correctly. Let's be honest, losing weight when you have rheumatoid arthritis is hard. You're dealing with pain, fatigue, inflammation, medications that are affecting your metabolism, and a body that's often working against you instead of with you. So let me say this clearly, the struggle is not your fault, but it is your responsibility to try to feel better. Because not every doctor tailors weight loss advice to autoimmune conditions, and not every plan out there protects your muscle, your energy, or your function. That's why you need a strategy around all of this. Don't just follow a generic trend. You don't need to lose weight like everyone else. You do need to lose it, but in a way that supports your rheumatoid arthritis. So if you're seriously thinking about using a medication, a GLP-1 medication like Semaglutide or Mounjaro, and if you have type 2 diabetes, metabolic syndrome, have difficulty losing weight, these medications can absolutely help and they can be life-changing. But like I said before, they're not a shortcut, they're a tool. And like any tool, it can help depending on how you use it. We don't want you to have more muscle loss and frailty. That's a major part of this, because that will make you more vulnerable to flares, which we absolutely do not want more of. So use your strategy wisely. You deserve a plan that works for your entire body and not just that number on the scale. Some of the newer medications that are in clinical trials right now are trying to support the muscle. So instead of losing so much muscle with these injection medications, they're trying to support it as well. But they're not released and out on the market yet. Keep watching for more though. Let me know in the comments what's been hardest for you with the weight loss journey, and share this with someone else living with rheumatoid arthritis. I'm Dr. B with Plant Forward MD. I'll see you next time.